Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Chapter 34 is Hematological Disorders. It's about red blood cells, white blood cells, bleeding, and lymph nodes disorders. And the chapter talks about 11 of them, and also each of them, while in the chapter they have terminology. Each keyword from the book, it's right here. Previous chapter 33 had 45 terms about labs, and this chapter is mostly like cells, and the blood is repetitive, some of them, and some of them they are new. And chapter 34, here they have same as previous one, 45 key terms, so it's a long chapter. So we go one by one. I'm gonna highlight each of them, and here also you can see the easy hint how you can memorize those, in case you are not familiar with. So allogenic, from a genetically different donor of the same species. So think allo, from allogenic. Allo means other donor. Same like when you say hello, allo, allo. So you talk to other person, allogenic. I think you always remember this, allo, allo. Okay, used in the stem cell or bone marrow transplants, so requires close matching to reduce rejection risk. Anemia. Let's go to the next one. So anemia, we know it's a condition where there are not enough healthy red blood cells to carry adequate oxygen to tissue. Deficiency of healthy red blood cells or hemoglobin, so it's decreased oxygen delivery. Low means fatigue, pallor. So think that all of the anemia that is from the red blood cells, all of them, they have common signs like fatigue, pallor, and short of breath. Most of it in outline. I'm going to next video. I'm gonna say about the red blood cells disorders, and when I talk pathophysiology, clinical manifestation, diagnostics, and nursing intervention, there I always say on red blood cells for each of them, fatigue, pallor, short of breath, and the key signs that they're specific for that disease. So can result from blood loss, nutrition deficiency, or chronic disease. So we go more on that in the next video. Let's see. Apoptosis, it's a programmed cell death, program regulated cell death, remove damaged cells. So it's a normal process to remove the damage or unneeded cells. So failure can lead to a cancer. So this, and we know that everything that is A means it's missing. A means like dead, right? That it's a prefix. Autologous, delivered from the same individual. Auto, it's a self donor. So autoimmune, me. In autologous stem cell transplant, the patient's own cells are used so to minimize rejection risk. So same like in the blood transfusion, there are surgeries that the patient will make a transfusion prior, of course, of their healthy blood, and then in case of a surgery it's missing it's a lot of blood loss, then the perfusion is on self blood, but also it's a blood tank, but um, just to minimize the rejection risk when it's about blood. Basophils, I was talking about basophils like for immunity chapters, keywords. There also they were about the cells and also the blood cells, so basophils, and also in previous chapters I talked about basophils. And again, I'm going to talk here. So basically, it's a white blood cell involved in inflammatory and allergic response. So it's a granulocyte release histamine and heparin in allergy inflammation. So B, it's like for bad allergy itch. So releases histamine, it's elevated in allergic reaction or chronic inflammation. Cobalamin, it's known as vitamin B12, essential for red blood cells production and neurological function. It's a water-soluble vitamin needed for DNA synthesis and neural function. So B12 short, it's energy. Deficiency leads to pernicious anemia and neurologic symptoms, but also B12, it's one of anemia that is talking about in the outline. The cryopelcipitate, it's a blood product rich in clotting factors. So cold insoluble plasma fraction rich in fibrogen and factor 8. So this factor 8 you will learn in outline which disorder affects the factor 8. So Cypro, it's like a cloth concentrate. I say Cyro. Okay. So it's used to treat hemophilia or massive bleeding. I just spoiled by saying the factor 8. Then this you learn in organic chemistry, deoxyhemoglobin, hemoglobin not bounded to oxygen. So D2 dark blood. So occurs when oxygen is released to tissues. Also gives venous blood its darker color. So this is the one that make the venous darker, bluish. Again, another cell from previous chapters and repetitive again here. Eosinophils, a type of white blood cell involved in allergic reaction and parasitic infections. It's a granulocyte, are active in parasitic and allergies. So it's that orange granulars. So eosin, evil parasite. So elevated in asthma, allergies, or parasitic disease. Then I'm gonna scroll a little bit down. Then we have erythrocytes. We know it's the red blood cell carry oxygen via hemoglobin. Red blood cells transport O2, CO2, carbon oxide via hemoglobin. So RBC, it's the red blood cells. It's the red orange. So the low count results in anemia, and the normal span it's 120 days. And in sickle anemia, sickle cell anemia, actually it's less than this and has that form of S. Erythrocytosis, an abnormal increase in red blood cells, increase in RBC's mass count, too many red cells. So this can occur in that type of red blood cells where it's too much. That means it's polycythemia vera. Or as a response to a chronic hypoxia. Next one, it's erythropoietin, a hormone made by the kidney to stimulate red blood cells production. Kidney hormone stimulating red blood cells production. So this it's used as a drug in chronic kidney disease to treat anemia. Glossitis, so it's an inflammation of a tongue, inflamed, smooth, beefy red tongue. So that means it's in B12 or iron lack. So it's a glossy tongue. This is like a key sign of symptoms of a disease. So it's a key terms that might be in the quizzes or in the case study for the NCLEX. Says the case study, oh, this patient comes and have this type of fancy key terms, you know. So if you don't know what means this word, you think it's anemia, but you don't know which one it is. And then if you know the key term, then you say, oh wait, it's that type of anemia. So I'm focusing, and then comes a flashback this type of anemia, and then you don't confuse with other anemia. So it says that it can be seen in B12 or iron deficiency, but mostly in B12. Tongue appears smooth and very red. So the graft versus host disease, it's a condition where donor immune cells attack the recipient body. Donor immune cell attack recipient post-transplant. So it's a common complication of allogenic bone marrow transplant mostly. Hemar Trosis, it's a bleeding into a joint space. You see here, I said hemophilia joint bleed. So it's often seen in those type of patients with hemophilia. It causes pain and joint damage. So moving forward, hematology, the study of blood and blood forming tissue. Hema, we know it's blood, and logi is the science of it. So this includes disorder like anemia, leukemia, and clotting disorders. Um, so includes like the RBC, white blood cells, platelet disorders. I mean this chapter. Hematopoiesis, the formation of blood cellular components, formation of blood cells in marrow. So is that formation of blood cells in the bone marrow? So involves stem cells. Okay. Hemophilia, it's a genetic disorder causing defective clothing due to factor 8 or 9 deficiency, because there are two types of hemophilia, so that's why I have a factor 8 and 9 deficiency. Hemophile, they say it's bleeding lover. So the patient bleed easily, and treatment include factor replacement treatment. So leads to prolonged bleeding. So basically, it's a genetic chlorine disorder due to this factor. Hyperviscosity. So it's like a thickening of blood. So hyper means big, viscous. So that's why thickening of blood. Increased clotting risk and seen in polycythemia. Yeah, so can impair circulation and increase risk of clots. I need to scroll down. So now we are in the term 20. Koilonychia. So it's a spoon-shaped nails due to iron deficiency. So this is a key term that same in the NCLEX or quizzes is like this patient comes and during the assessment nurse observe and then says this keyword, and if you don't know, then you might think it's an anemia, but you don't know which one. So we know the spoon nails, which is associated with iron deficiency anemia. So this is a good indicator. So think about those spoon-shaped nails. Leukocytes, it's a white blood cells that fight infection. Leuko means white soldiers. And which we know They are agranulosis and granulosis, and then agranulosis versus granulosis. So they have neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So fight infection, and we go to leukocytosis, an increased number of white blood cells, elevated count. It's more than 11 K. Infection alert, of course. What we know, so often is due to infection, we know this, or leukemia. So that it's an infection alert. Often a response to infection, inflammation, leukemia. Then, oh Lord, Lermite sign. So it's electrical shock-like sensation down to the spine with neck flexion. So it's the lack of B12. It's like a lightening spine. So we know it's in B12. Sometimes also it's also seen in multiple sclerosis. Lymph, fluid that circulates through the lymphatic system, interstitial fluid in lymphatic vessel. And so contains white blood cells, which filters through lymph nodes. Lymphocytes, it's a type of white blood cell involved in immune response. The B and T cells providing adaptive immunity. So lymph node guards kind of thing. So it's a type of white blood cells, B and T cells, and involved in immune response. So B, we know it's antibodies, and T, they are cell-mediated immunity. Monocytes, it's a large blood cells that differentiate into macrophages. Mono means macro, the eaters. So engulf and digest pathogens and dead cells. So we know that those type of white blood cells become macrophages, which engulf the pathogen. The myelodysplasia, it's a group of disorders caused by poorly formed or dysfunctional blood cells. So it's a group of disorders caused by poorly performed dysfunctional blood cells. Clonal marrow disorder with ineffective hematopoiesis, dysfunctional marrow. So make progress to acute leukemia. Myeloma, it's a cancer of plasma cells in the bone marrow, malignant plasma cell tumor producing M protein. Put it here. And so leads to bone pain, anemia, and kidney dysfunction. So I'm going to scroll a little bit down. Here we go. So we are here. Myelosuppression, a decreased bone marrow activity leads to reduced blood cells. Decreased marrow activity, low red blood cells, white blood cells, platelets. So it's kind of chemo side effect. So it's the common side effects of chemotherapy include the infection, anemia, and bleeding risk. So keep in mind it's caused by chemo disease and suppression of bone marrow function. Neutropenia, low neutrophil count, which increase risk. Neutro means low. So increasing risk of infection require protective precaution. So in the chapter, it's kind of saying about it, but not categorize it. But I categorize it there when I review it. So keep in mind it's increased infection risk because it's a low neutrophil count. Neutrophils, it's the most common white blood cells first responded to infection. Actually, it's a low in chemo patients. So neutro ninja. So it's a key fighting bacterial infection elevated during an acute infections. So it's the most abundant type of white blood cell. Oxyhemoglobin. Hemoglobin binds to oxygen, arterial. So oxy means oxygen, so it's oxygenated. So we know carry oxygen from the lungs to the body and gives blood its color red. So the oxyhemoglobin, it's actually measured in pulse oximetry, the pulse oxy, the oxygen saturation we call it. So hemoglobin bound to oxygen. Pancytopenia, deficiency of all blood cell type. So pan, it's all cell down. So this is seen in aplastic anemia and bone marrow failure. So it's reduction of all blood cells. And panmyelosis, overproduction of all three blood cells lines, pan, all cells up. So you see pancytopenia, cell down, and this, it's the opposite, overproduction of all three. So can you see here, this it's down, and this is too much. So this is seen in polycythemia vera, another red blood cells disease caused by thick blood and increase in clot risk. So proliferation of all blood marrow components. Pernicious anemia, Pernicious anemia, It's autoimmune B12 deficiency due to lack of intrinsic factor. So it's B12 pernicious. So leads to anemia and neurological symptoms. So causes neurological symptoms. So it's an autoimmune B12. Phagocytize to nerves and digest particles or pathogen. So it's a function of neutrophils and macrophages in immune defense. Pica, it's another sign, a keyword. Craving and eating non-food substances, craving non-food items, eyes, dirt, often in iron deficient. So they say eyes much iron low. So we know that it's linked to iron deficiency. So keep in mind craving for non-food substances. Can you imagine like people eat the ashes? I heard that. To eat ashes. Platelets, cell fragments essential for clotting. Cell fragments for clotting is here. Thrombocytes. So low count means bleeding risk. High count, it's clotting risk. Polycythemia, increased red blood cell mass. Poly means mean. So it's B primary vera and secondary from chronic hypoxia. So we know that may be due to chronic hypoxia or this type of disorders on elevated red blood cells count. Polycythemia vera, myeloproliferative disorder causing overproduction of red blood cells. So it's a thick blood disease. So increased blood viscosity and clot risk. So treated with phlebotomy. So it increases clot risk because of this overproduction of red blood cells. This test, Schilling test, it's a diagnostic for B12 absorption. So this is another key term that it's typical for B12 absorption. So for this, it's used to identify the cause of pernicious anemia, but now it's rarely used. So it's a test for B12 absorption. The thrombocytes, another term for platelets, so involved in blood clotting. So it's very essential in blood clotting. Here, thrombocytopenia. So think also pnea. Everything with pnea means also low. Low platelet count. Thrombo, it's mostly like name of, see here, thrombocyte. So it's a cell, thrombo, platelets, and then thrombo and pnea. Thrombocytes, so platelets, cells, low. so leads to bleeding and bruising, which are common in chemotherapy or autoimmune disease. So keep in mind its low platelet count and increased bleeding, risk of bleeding, and thrombocytosis. Here I make an error. You see, I'm supposed to put pnea low and cytosis high. Sorry here. So here it's a high platelet count. Can increase the risk of clotting either directly or due to a bone marrow disorder. So increase of risk for clotting, and previous was increase of bleeding. This is increase of clotting. So to know cis is like increase of clotting, and this pnea increase of bleeding. And this is low, this is high. Thymus, it's a lymphoid organ where the T cell mature in childhood. So this is active in childrenhood and shrinks in adults. So it's more active in children, that means. So it's organ where the T cells matures. Okay, we're moving a little bit forward, and I will show you a previous little bit of next chapter. I meant not for the next video. I meant for the next next video. It will be outlined, and I will talk more about it. Not next chapter. Next chapter it's about skin. So I want to show you that correlating clinical manifestation to pathophysiological process. So the next chapter has 11 disease that they could categorize the book, but there are a little bit more than 11. And this is the main ones. So the iron deficiency anemia, these are the keywords that you need to know. We talked about the brittle nails, pica, and the B12 and Pernicious anemia, the glottis, memory changes, folate deficiency, similar to B12, but without neurological symptoms. Sickle cell has that S style hemoglobin, aplastic anemia. It's due to marrow failure, and then bleeding infection. The G6 is the glucose 6, and fava-bean sulfa drugs. Polycythemia vera, it's increased red blood cells, we said already. Viscosity, then thrombocytopenia. We talked about thrombocyto and pnea. Then the a little bit here about the lymphoma, and you can see this is just a quick review. And correlating clinical manifestation to pathophysiological process. This is actually one of the learning outcomes from this chapter. The book has 7 questions, and this is question number 2. And in the next video, actually, I will go one by one. So this is a short screen from what I'm gonna talk on my outline video about learning outcomes. So this is number 2, just to kind of have a short screen uh, like a quick note um, how this chapter it's all about. And here we have like mix and match questions for 34. And this is like for like when you take a quiz, like how um, you see correct match and the description or definition. It's very quick and handy if you have this short script to before your quiz because they have the keywords. Okay. And I hope you will enjoy these key terms. And I know the key terms is not fun of students. They kind of annoying to know the key terms. But if you know few of them, then I think it makes easier. Like we were talking about the B12 test, then the difference between the low and increase of platelets and what is the name. And now when you go to outline, then you can already know, you have an idea, oh, this is about this. I hope you enjoy that. I really do. That's why I make these, because for me, I need to know first the key terms. And while I know them a little bit, then when I read the chapter, it shows the definition in the chapter, but already when I see the bolded term, already it's pop up. Oh yeah, I know what it's talking about. So when I scan a little bit through the chapter, I think will make much easier to learn, especially for non-native English speakers, like somebody that emigrate and kind of get a little bit confused. Because I emigrate here and about 15 years ago, and all those years I'm in continuous studying, in continuous learning key terms, and I feel like I'm in junior high. I'm in a junior high constantly because only in junior high I remember doing key terms and doing outlines and doing concept maps. There I learn. And nursing math, that you need to calculate the dosages and everything, the formulas to make them, and how the question goes, and you need to get the result. Basically, it's a junior high math for me. But back in the days, in my junior high, I did like with apples, pears, all kind of fruits, but the concept is the same. So when I see nursing math and some students are struggling with nursing math, for me, I laugh inside me because I used to do with apples, pears, oranges. um, so that's because I got annoyed with those type of questions when I was in the 5th and 6th grade. So that's why now it just pop up century later, decades later, it show up, and I have to make this. So for me, math for nursing, it's very, very easier for me. But if you struggle and you hear me now, give me a comment and I will teach you. Like, you will know, because I categorize like in 2 steps or 3 steps, and it's impossible to don't remember those with my apples and pears and oranges. So that it's like with milligrams, with grams, because being a European, we learn grams, milligrams, meters, kilometers, liters. For me, these measures, I know how much is 1 liter. I don't I don't need to kind of visualize how much is a liter or 5 liters. But if you tell me gallons and cups and oh, that's complicated. Ounces, this for me is complicated. But the other side, uh, milliliters, grams, uh, better than knowing, oh, I give 2 tablespoons. Wait a minute, a tablespoon, how much is a tablespoon? It's 15 or 5? Oh, okay, guys. I hope if you struggle, let me know. I will help you. Okay. Um, I hope you enjoy, and we hope in one day we can meet.